Will would like to know, I heard that CMS has declared again that there is a COVID EUC hardship exemption available for the 2023 performance year. Does that mean we don't have to submit anything for MIPS in 2023?
Great question, Will. Before I get into expectations for the 2023 performance year, let me point out that Medicare is still accepting applications for COVID hardship exceptions for 2022. Medicare is accepting applications until March 3rd. For 2023, the answer is maybe, but consider carefully before you skip your 2023 submission. Medicare is not granting any special consideration for COVID for 2023. They're simply stating the obvious, that you can always apply for a hardship exception for any reason if you believe one exists for you for any reason, including COVID. Now, I'd also like to point out that I've just heard in the news that the intention of the White House is to end the official public health emergency on or about May the 11th. So by the time our next reporting season comes around, and certainly for more than half of the performance year, we expect to no longer be in a COVID health emergency. Regarding this new announcement about COVID hardship exceptions for 2023, the first thing I observe, and it's not an automatic exception, as has the first three COVID affected submission seasons. In those years, if you did not submit, Medicare applied an automatic exception and non-submitting providers were not subject to any adjustments. So far for 2022, and the expectation for the 2023 performance years is you don't get an exception without applying for one. We are late enough in the submission season for 2022 data that we're unlikely to see an automatic exception added to the 2022 submissions year. I don't think we'll see one for 2023 unless there's a new variant or a new infectious agent that is more infectious and or more fatal than what we are now seeing. Second, observing that COVID still affects all healthcare practices to some extent, and the exception is not automatic, expect it to require more than just the existence of COVID to warrant an exception. Your application should reflect how COVID is in the way of your participation. Did key clinicians or support staff suffer prolonged infection-related complications? Was your community or practice overwhelmed with COVID or complications? Did you use practice resources to upgrade your infection control infrastructure? Third, on the surface, this is a meaningless reminder. It should now be obvious to everyone that COVID is here to stay. And the hardship exception applications have always been available to quality payment program participants. We should expect always to be able to apply for an exception for MIPS on the basis of COVID-related hardships or any other hardships. I don't expect Medicare to ever say there will be no more hardship exceptions granted for COVID. Fourth, by choosing to remind us, Medicare is encouraging us to use the hardship exception. And by encouraging it, are implying an intent to be lenient when approving applications. Because Medicare issued a reminder, I expect more practices will apply for hardship exceptions than otherwise would, and I expect a high level of approval. But a fifth and final warning. Though it's reasonable to expect leniency, you won't know until Medicare starts accepting and acting on applications just how lenient they're going to be. And the degree of strict or lenient we experience early in the season may not be the same as late in the season as the political and infectious environments evolve. Whatever you experienced last year may not be your experience this year. Whatever you experience this year may not be the experience next year. Apply for an exception if you need it. Support your application with concrete and credible observations. Don't assume acceptance is going to be granted until it is. Will, I hope that answers your question.